Lillian McDermott, weekdays at noon on AM 1510, FM 99.9, 94.7, and 100.7. The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, folks, your host for Helping Seniors, the radio arm of Helping Seniors of Brevard County Incorporated. Our job is to inform, educate, and connect seniors and those that care for seniors with the resources that they need in Brevard County. And often we help them connect with resources that are outside of Brevard County, too. We're getting calls from all over the United States now because for some reason, people find out more about a resource like ours. They call us. They want to help a family member that lives here while they may live in New York. We've had calls from New York. I know I've had calls from Virginia, a number of states. But it's all important. It's all part of what we do. And it's all part of really advocating for seniors. Today, my panelist is Dr. Lee Sheldon. And Dr. Sheldon is also one of the sponsors and helps make this program possible. Some of our other sponsors include the Eye Institute, Bill Johnson Elder Law Attorney, this radio station, 11 Home Cares on Beachside, Ebony News Today, Riverview Senior Resort, Brevard Chiropractic and Neurogen Center of Rockledge, Marker Street Memory Care, and we're picking up new sponsors in the last 2 weeks. I think we've added 4 more new sponsors to our list. We're closing in on 30 sponsors. Our goal is 60. So we'll get there. We will get there. And, it's we started, and I'll talk about it later on the show about our $100 a year club. I'll talk about that later, but I don't want to delve too much on the subject of money and finances in the first part of the show. Dr. Sheldon is anxious to talk. He always is anxious to talk, and we're going to talk about getting a second opinion. And well, Dr. Sheldon we're going to talk about it from the medical aspect, but I'm sure we'll get into parts where people need to take more of an interest in their own life. Second opinion can apply, Lee, not only to medical, but to getting a garage door installed, to getting a plumber to fix your there's just so much. So welcome.
Yeah, well, thanks, Joe. It's good to be with you as always. And we have, I've written this article, and we did a little TV show, which probably isn't on the air yet. And it's now I'm going to talk to you about it not as a medical professional or as a dental professional. I'm going to talk about it as a consumer because I've just been a consumer, and a family member has been a consumer. And when you have the experiences that we've had that are within the area of healthcare, then you start to say, all right, maybe there is room for another opinion, and maybe the second opinion is a worthwhile thing to do. And in this case, in both cases, the second opinions were the right things to do. And despite the fact that we may have been seeing qualified professionals the first time around, just as in roofing, plumbing, electrical work, contracting, where you should get more than one opinion, you should do it in healthcare as well.
Well, we have found now in our organization, of course, Helping Seniors was founded in July of 2011.
I was there.
We're starting our 6th year,
That's right.
Really. But it takes time for an organization to develop and for people to understand what the objectives of that organization is. But we're finding that we have some people that, like a roofing company just became a sponsor because the roofing company actually worked with somebody we know quite well, and she was very satisfied with how they worked on her roof, and she told them about us, and they became a sponsor.
Great.
But here's the value. If somebody knows and they want to be recognized in Senior Scene magazine, the newspaper articles, a radio show, television shows, people become more informed about programs that are assisting seniors.
Yep.
And they have at least have a better idea of where to go. When you start talking about the yellow pages, there's a whole lot of stuff in the yellow pages. And how does anybody really know where to look?
No, you're right, and it's also, of course, these days it's the internet, and from a healthcare provider standpoint, I can talk from that standpoint. I'm very proud of what we do in our office, as you know, and I do think that we provide the best dental care that we possibly can. At the same time, I've also hired some of the best marketing agencies to market my practice. Well, if those marketing agencies can market my practice, which I think is a very above-board, high-quality practice, well, they can also market the other practices. And so when you're looking at advertising, whether it be in the yellow pages or on the internet or on Facebook or wherever you're looking, understand that we're hiring the best marketing professionals in order to be able to promote our service, to promote our business, to promote our practice. And so the consumer still has to be careful when he or she gets that advertising in whatever form to make sure that in fact they're seeing the right person.
Yeah, but since we've been in business now, some of the other organizations that are already serving seniors are recognizing more what we're doing. And for instance, just talk about a guy named John Frederickson. John is the publisher and editor of Senior Scene magazine, and they reach about 40,000 people a month. They put 12,000 copies of their magazine out. It's a free magazine, and we have an 8-page newsletter in there, and we've edged the newsletter insert in the magazine with yellow edging. So now people are calling it the yellow edge, the senior yellow page book. And if people want to pull our newsletter out, the magazine, post it someplace, they can certainly do that. But it lists all our sponsors in there, and that's one of our objectives. If we can make organizations that do help seniors, that are friendly to seniors, if we make more of these organizations part of our network, and people will have, we ultimately hope to have 100 or more involved in our network, and it'll cover almost anything a person could have need of in a service. And we're trying to get organizations that serve the entire part of the county. There's no exclusivity for anybody. We don't do that. There are 545,000 people in Brevard County, 245,000 qualify for senior citizen status under AARP standards. So not one home health care agency can serve 245,000 people. Can't do it.
That's right. And so you are looking, listen, it's the whole principle of social media, just as helping seniors of Brevard County. You're looking for something or an organization or a person who has experience with that particular individual, that particular company, that particular service. Exactly. And essentially helping seniors of Brevard County doesn't accept somebody unless that person is a honest and above board and qualified professional. And I'll take it one step further. I'm no longer on the board, but I can tell you this with real assurance. If it's discovered in helping seniors of Brevard that one of our sponsors is not an above board person, that person isn't going to be a sponsor anymore.
Exactly right. Yeah, exactly right. And we got a number of people who called. In fact, we have a few that we did not admit as sponsors. Most nonprofits struggle so hard to raise money they'll take anything they can get, and I don't mean that in a malicious bad way, but when you got to raise money to pay bills, you got to do it, and most nonprofits don't have a reserve. So that's one of the reasons that we formed this advocacy group for helping seniors, because we're on a task now where one of our objectives, Lee, with this new advocacy council is, and we've got some pretty strong people that were former managers of major companies in Brevard County now talking to us, and they believe that part of the solution is to cause the county commissioners to designate more funds in the community-based operation fund for Brevard County. Just digress just for a second. because people, they need to know, just like I've got some papers here I pulled off the National Association of Elder Law Network talking about the repeal of the Affordable Health Care Act. There's so much that it appears to be one thing when it's actually something else. When we get into this Health Care Act, if this act is canceled tomorrow, it'll take a couple of years, 3 years maybe, for some of the things that have already been acted to get resolved.
Yeah.
We put ourselves in a hole that if we don't get it stopped, it's just going to make it hard to recover from it. I think we recover from anything if we put our minds to it. We also have to put our wallet to it. And these bills don't pay for themselves. You don't start new entitlement programs, but I don't want to get into that today. I want to try and stick with the topic today.
Nah, we've never done that before, Joe. Why start now?
Well, I think it's important because we got 12 questions, and I am going to make sure that I ask you to comment on these 12. Well,
last time we did this interview, how many of those questions did you get through? We did a half-hour TV show. How many did you get through?
About 6 or 7.
No, about 1.
Oh, no. We got more than that. Okay, I got the same show we did on TV.
All right, good.
All right.
But this we're relaxed. John Harper's giving us time to do this. We can schmooze a little bit. There's no pressure.
Yeah, I don't want to go to sleep.
All right, I got it.
Okay, I don't want to go to sleep. But, you yourself have had some personal medical experiences, and I'm not talking about a guy that does impact dental work, breaking your own teeth off on hard candy. That's not what I'm talking about. But he has done that, folks. He has done it not once, but twice. He didn't learn his lesson.
Yeah, you got a good memory.
Maybe our conversation today, Lee, will help people understand why it is important to get a second opinion, not only for medical things, but for other things around our house, personal care. Finance is another thing. You may have a broker that's leading you down the primrose path.
Yeah, you're right.
Sometimes it's good to talk to another broker, and you might find out that what you're doing is not the best in your best interest.
Well, I'm going to give you an example today that's not personal. I'm going to give you one that just happened right now, and it just came to mind. May I?
Go ahead.
All right.
Yeah.
So I saw a patient yesterday, and the patient has a very busy schedule, has a pretty important job, which leaves him, which means that he's out of town a lot. And he came to see me and wanted an opinion because there are some major things going on in his mouth. And so I was sitting with him, reviewing the data, and usually I'll come up with a treatment plan at that first visit, which I did. And I came up with the treatment plan. He had to go. I gave it to Jennifer, my chief of the front desk area, and I said, all right, here's what we ought to do. And so we gave it to Jennifer, and Jennifer sat down and added it up. And she said, do you know how much this is going to cost? And I said, well, how much? And she told me how much it's going to cost. I'm not going to reveal that in here. But so she then wanted to know what steps I'm going to take and how we're going to do this. What are the visits? Because he has an out-of-town schedule. We've got to make sure he's in, and then he can get out of town and then come back and perform the next service, because it's going to take several visits to get it done. So we went over it in terms of visits. We went over it, and I went over it, and I said, I can save him $20,000 by doing it this way. So I even gave myself my own second opinion, and I said, if we do it this way, here are the risks, and here are the rewards. And if we do it this way, here are the risks, and here are the rewards. If you want my personal opinion, he personally would be better off with the less costly treatment plan than the original one that I offered. So you also want to give your medical professionals time to think and go through it, because sometimes what we say the first time around may not be what we come up with as we think about the case longer. And I've had this happen before, where a patient says, can you give me another way? And I go back and I look at it, and sometimes I say, no, I can give you another way, but I don't think it's going to work. Or I'll look at it and I'll say, well, we could do it this way. It may be a lesser service, but it'll be a predictable service, or it may not be a lesser service at all. So there is the opportunity for good interaction with your medical professionals in order to be able to get that second opinion from the one that you really trust before you have to go someplace else.
That's a good point. And you raised another point when you talk about, you mentioned somebody you trust. Quite frankly, sometimes somebody that you trust may not be giving you the best answer.
That's right.
Friendship is important, but when you consider your health, I think health trumps friendship. I think.
It does, and it does, and I've seen this a lot of times. Where my uncle was the dentist and that type of thing. I've seen that, and when you go back and look at it, you say, well, listen, there's some things that could have been addressed, that need to be addressed, and frankly, you'd be much better off if they are addressed. So, yeah, blood may be thicker than water, but still, there is such a thing as competence, and varying levels of competence. And as we've talked about in the air a number of times, varying levels of ethics. And so you really have to, to look at it from that perspective.
You didn't bring the gentleman with you today, but I don't know if you can remember. We don't have to mention any names, but could you? You had a couple of examples on a TV show, and how much you remember about the fellow we had?
Yeah. Well, let me talk about my personal example first, because that's one that hit me. And that's with my wife, and she had some things which led her to have a colonoscopy done, and she had the colonoscopy done, and as soon as the colonoscopy was over, I was in my office, and I was told to come down to the colonoscopy center, that particular office, right away. And so I, of course, if I'm told to do that, I do that, and of course, when you're told to do that, you're thinking the very, very worst. So I showed up, and we were told that there was a particular problem in the colon, and it was a polyp. As you know, a polyp is an outgrowth of tissue inside the tube, inside the colon, and usually polyps can be taken off, and they're biopsied, and everything is okay, and assuming they come back benign, everything is okay. Well, this particular polyp was not one that stuck out of the wall, but it was one that was flat with the wall. So it was even with the wall, and the doctor had no way of removing that, and told us that biopsies were taken, and we'll get the results of the biopsy, but no matter what, this needs to be taken out, and it needs to be taken out surgically. And so the doctor made an appointment with the surgeon for us, suggested some surgeons, and we went to the surgeon probably the next day or the day afterwards, and the surgeon confirmed that based on what this particular problem was, that the way to be treated was to do laparoscopic surgery through the abdomen, and portion of the colon would be removed, and assuming that everything was okay on biopsy study, that everything would be okay. It would involve anywhere from 3 to 7 days in the hospital with a 4 to 6 week recovery period. So that can take you aback. You have a colonoscopy, everything's doing okay, and you're told that you need to have major abdominal surgery with that kind of recovery period. So I went back and I looked in some of the medical literature myself, which is the one departure. I can read the medical literature. I got a little bit more data on this particular problem, and then we went back to talk with the doctor once again to get the results of the biopsy, and found out that the biopsy was benign. There were no problems at all, but still it was recommended that this lesion be removed. So after digesting this and seeing what kind of hospitalization that would be involved here, we asked, is there another way? And we kept on asking, is there another way? Is there another way? And asked, 2 or 3 times, indicating that there was no way that surgery was okay. And finally the doctor said, well, there is this doctor at Mayo Clinic, and he's a gastroenterologist too. And the doctor has a way of removing this lesion through the colonoscopy. That this particular doctor locally couldn't do it, but this doctor in Mayo could. Doesn't involve abdominal surgery. It's a 1-day visit. It's an outpatient type of visit. And we said, well, yeah, of course we'd want that. Why would we want to have surgery through the abdomen, which when in fact it could be done through the colonoscopy? So we went up to the Mayo Clinic and consulted with the doctor who does this procedure. He's been doing this procedure for 10 years. He'd done over 2,000 of the procedures. They're 98% successful. In other words, only 2% of the time did abdominal surgery need to be done. And he teaches it all over the world. So Eleanor had the procedure done. It came out just fine. She had the little bit of discomfort that you expect over the next couple of days when somebody is taking out something from inside your colon, but it was taken out, internally rather than through incision. And 3 days later, everything's fine, and she's doing very well. The question that she asked, and the question that I ask, is this: why did we have to keep on asking and asking and asking before we found out there was a better, much more conservative way that was tested that the doctor already knew about? Why did we have to even think about the appointment with the surgeon when, in fact, there was a non-surgical way of doing this that was 98% effective? Good question?
Yeah, it's a scary question.
It is a scary question. And and notice, we didn't go to a second local gastroenterologist. We kept on asking and asking and asking the first gastroenterologist, which may be an example of why a patient could ask me a second time, is this the best way? And I come up with a different answer. We kept on asking until we got the right opinion for her.
Thanks. We're getting a signal. We're already at the mid-show break. We got 8 questions to go on the other side of the show, so stay with us. We've got some things we really do want you to hear, so stay with us.
WMEL.
This is Joe Steckler, folks. We're back live with the second half of this edition, Thursday edition of Helping Seniors. I remind everybody again, our job is to inform, educate, and connect seniors and those who care for seniors to the resources available in Brevard County. Katie Geiser, our information specialist, can be reached by calling 321-473-7770. And some of the sponsors for the second half of the show include Senior Scene Magazine, Seniors Helping Seniors, Courtney Braswell Financial Group, Barbara McIntyre from Home Equity Loan, Canadian Meds of Melbourne, Vitas Hospice, In-Home Personal Care, and Handy Pro of the Space Coast. We got a whole slew of sponsors, folks, and to find out more about them, call Kay at the office or pick up a Senior Scene Magazine. Look at all of them that are listed there. There's so many wonderful people that are doing many wonderful things to help people in Brevard County, and more of us need to know about all the services that are available. And that's really one of the things that we're trying to do, is make you aware of what's available. Dr. Sheldon is my panelist today. He's got one personal example, one more to share with us. But before we get into that, we'll see how we work with that with time. But keep that in mind to share, Lee. We want to try and do it if we can. But why has this become important to you at this time?
Well, it's important to me because it's happened to me personally. So if it's happened to me personally, and I'm a fairly well-educated guy who's had interaction with physicians my entire career, as you know, because I had a TV show for 8.5 years.
Yeah.
Then if it can happen to me, it can happen to you. And, you can ask questions, too, as a consumer. You don't just have to be a doctor to keep on asking questions.
You know your body better than anybody else.
That's right.
And if your body's telling you something and you're going to a doctor and you don't see any change, then I'm fine going to say that, because I got some problems right now, and I'm taking all kind of medication and I'm not really seeing any change. And a doctor's trying very hard, but it's, maybe it's that some things can be fixed and some things can't be fixed.
No, you're right, but you can also read some literature, and let me give you this website, pubmed.com, PUBMED.com. That's the portal to the National Library of Medicine, and you can type in your disease and you can see what's been published on that. It's a little bit difficult to read, but not all that difficult to read. You can start to get an idea not only as to the data that pertains to a particular problem, but you can also see the doctors who are continually doing the research. You see the same authors, you get the idea that those guys are the expert. Then you can call one of those guys and get a second opinion.
Well, the other part of asking about a second opinion is one of the questions I had here was, we can talk about prescribing things, fixing things, but and while doctors study more about what medicines can be used to fix something, we don't do quite the same amount of research on taking people off of medications.
Absolutely not.
And that's a real danger, and that's where I have my own personal problem because they prescribed a drug, Lyrica, for me.
Yeah, let me interview you for a second. Okay, so essentially, you had a particular pain problem, correct?
Right.
All right. What was the pain problem? Just wanted to.
Well, it was diagnosed as fibromyalgia, and I hurt from my knees all the way up to my neck, and I was having hot flashes, I was having cold flashes, I was nauseated over a period of 3 months. I was nauseated. I didn't feel like doing anything. I didn't have any energy, and I ached like hell.
This is after you started taking the drug or before you started taking the drug?
Before.
Okay, so you saw your physician. The physician recommended some medication, right?
Well, he had thought about this before, but he'd held off, and he wanted to try these other things first because he wanted to see if we can do something easier. And maybe it would solve the problem. And we were trying a lot of things. Between my cardiologist and between my primary care physician, they were talking back and forth. And so they finally decided to try the Lyrica. And I really couldn't see any that was helping me. But in fact, I was retaining fluid, a lot of fluid.
Okay.
And when I talked to my primary care physician, he said, that's one of the major side effects of Lyrica. He said, let's just stop it. And he said, we'll get you off of it. So
How long had you been on it at that particular point?
I've been on it about 7 months maybe.
Okay.
And
by the way, Joe was suffering because Joe and I would do the radio show together, and there were times when you couldn't even do the radio show. That's how much you were suffering while you were taking that drug.
Yes. And I had gained almost 30 pounds of water weight. And and it was also affecting my blood pressure and carrying all that extra fluid. So I went off the medication. The problem was I probably should have gone off the medication slower than we actually made a decision to take me off of it, because when I started going off the medication, that's when I started having these horrible dreams, hallucinations, cold flashes, hot flashes, extreme pain, nauseated, and this lasted for about 3 months. Well, Terry did some research on the internet, and we found out that people that had come off of Lyrica, many of them had experienced the same thing I did. And then I found out a chief petty officer that worked for me when I had command of Sailfish, the submarine, years ago. His daughter had gained, I want to say either 70 or 90 pounds. And when he read about my experience with Lyrica, because I posted it so people would know to look for it for themselves, lo and behold, her daughter was taking that medication. They took her off the medication, and they took her off a good way, I guess, because it didn't really affect her going off of it like it did me. And she didn't retain any more fluid or anything, and she lost 70 pounds.
Wow. Now, let's go back to your experience for a moment. At the time that you and I had this discussion, because we had this discussion while you were on the drug,
right?
And I said it could be the drug. And at that time, you were talking with your physician, but there was somebody that you consulted with, as I remember, somebody in Louisiana, or somebody, it was a nurse or a pharmacist or somebody who had done some research for you.
Okay, this is a young lady that had gone to church. I knew her very well, and she had become what they call a PharmD. She was a pharmacist.
That's a doctorate of pharmacy. That's the top level of pharmacist.
And she was working with this hospital over in Mobile, Alabama. So I called her and asked her if she'd review my medications. And I told her what had happened. She said, send me a list of everything. So I did. She worked on it 2 days. And she came back and she said, what you're taking now, there is nothing that should conflict with anything else. In other words, what I was taking was, once I got off the Lyrica, and there was another drug I got off of too. And since then, I've stopped one more drug. And I'm basically down now to my heart medications, which I've been on for years. And I'm not going to stop those because I've had so many heart problems that, I feel like my cardiologist has kept me alive. And because I've had some very serious heart problems, as you well know. But after I felt a lot better once I had a pharmacist with that type of degree analyze the effect one medication might have on another, and she called me up and said that that what I was doing was okay, and I didn't have to worry about the medications I was taking.
Well, that's good.
That was after I got off some of them, though.
And it's true, and there is drug-to-drug interaction, and there are, often there isn't enough research to know when you're taking more than one drug or 5 or 6 drugs, how each of them react against each other. So she was able to go back to the literature that was there, that we have,
yes,
in order to be able to help you determine that, in fact, you were okay in terms of drug-to-drug interactions.
But of the 360 million or 330 million people in the United States, how many, first, know to do something like that? Second, have a contact they can go to do something like that? Of course, you can go to your pharmacist and ask them pretty penetrating questions to get some answers.
I think that's a really, really good point. As doctors learn how to prescribe, and I was going to say we, but I prescribe pain medications and antibiotics is primarily what I prescribe. Mine is a short-term type of thing. But as doctors learn how to prescribe, as you said, but don't have. There isn't a lot written on how you take somebody off. There is a book that was written by a Harvard psychiatrist years and years ago called The Antidepressant Solution. Now, Lyrica kind of falls into that same category, not quite, but it kind of falls into that. And essentially, he writes of the experiences of 4 of his patients who were getting off of antidepressants and what they experienced. And, 4 patients with 4 different ways of getting off a similar medication. Some could get off it right away or within a few weeks. There was one who had to take an entire year, just weaning it down just a little bit, like a grain at a time, until he or she was finally off the medication. So, yeah, there is individual biological variability, and our ways of processing medications, as we all know, are different from person to person.
Yeah, and I'm probably, my wife has wanted me so many times to take the time daily to write down how I feel at different times. And I guess I believe I'm so busy that I just can't take the time to do that. But I'm making a mistake, and I'm saying this, folks, because all of us need to take a little more time how we treat our own bodies, because how we treat our bodies can make us vulnerable to other illnesses, sicknesses, and diseases that probably wouldn't happen to us if we took better care of ourselves.
Well, that's true. I mean, we've talked about prevention on this show a number of different times and where we go. But once you're on the medications, then it's a whole different level of care that you have to give yourself. And you really need to, as much as we think we know things, I'm talking about if we have a degree next to our names, there is certain responsibility that you can take, too, to read up on anything you're taking so that you are as aware, if not more aware, than your physician is as to what can happen if you take this drug.
Oh, one of the other, and just to go along with what you're saying, one of the other things that I wanted to talk about was how can you best discuss your problem with your doctor?
Yeah, and I think if there's a question, if the doctor seems rushed, you ask the doctor, can we have another appointment? We can spend a little bit more time talking about this problem. Now, I understand there's a lot of pressures in medical care because physicians only get paid a certain amount of money for an office visit. But still, you'll find physicians who will take the extra time to sit down with you and talk with you to really solve whatever questions or to answer whatever questions you have. What's important is that when you do go into your physician, come in with a prepared list of questions. I can tell you that there are patients who come into me because we do major dental procedures. They have questions to ask, and they have a prepared list. That's good. There are those who start to talk about other people's experiences and personal experiences that have nothing to do with what the question is. You really got to be focused on what you're trying to accomplish, and treat it as an interview Just as I interviewed you just now, Joe, and as you interview me, specific question to a particular objective, and then once you've got that answer, then go on to the next.
Yeah,
next
well,
question.
why was it important for me to see the doctor that day? That's what I want him to know.
That's right.
I want him to know that. The other thing a lot of people don't understand just when it is time to get a second opinion.
Yeah, I number one is if he doesn't feel good. You have this innate sense. You don't know what it is, but it just doesn't feel right. Second is when you have to make a major commitment to do something, particular surgery or particularly some major drugs. Then it's time for a second opinion. Third thing is when you yourself aren't feeling good after you've started the next medication or the next procedure. Maybe it was the wrong decision for you. So, don't keep on doing the same thing with the hope that results are going to occur. If you've gone a few weeks and no results are occurring, it's time to either talk to your doctor and say, hey, let's regroup here, or talk to another doctor and ask whether you can regroup. And the final thing is, if you're doing something that a specialist can do, and you're not getting the results with your generalist, and whether it's a dentist or whether we're talking about a physician, there's a specialist in that area. Find the specialist who handles that area and get an opinion from a specialist.
That's a good point. That's a real good point. I think that along with that goes the importance of the patient establishing a good relationship with the doctor. If you have a good relationship with the doctor, you can do exactly what you just said.
Yes.
The doctor can only operate so long in a vacuum. If you don't tell the doctor, let's say there's so many people that just don't want other people to know their private business. And when you carry that over to your doctor, you're making a very foolish mistake.
Oh, there's no question about it. Your doctor should be able to. You should be able to share every experience with your doctor.
But
First of all, there's a reason for doctor-patient privilege. That means when you're sharing information with the doctor is obligated not to share that information with anybody else, unless you give him permission, of course.
Because a doctor can go based on what he's done, his experience with other patients. He can see similarities between patient and patient, disease, cause, effect, relationship, if he knows the whole story.
Yeah.
But if he doesn't know the whole story, he can't. You're causing the guy to operate at a disadvantage that's not fair to him or her or you.
Exactly right. And I've recently undergone that experience with a friend of mine who had been hiding information from the doctor, and sure enough, that information was pretty critical to the problem that
Okay, there's one more thing, and I want to know about how I put this down last night because it was a question that came up. We had talked about it during the TV show, but I added a question. I said, knowing when to shift doctors, it's a hard call, and it's going to become more difficult with the decreasing numbers of doctors that we're going to have.
Yeah, and right now a lot of people are not seeing doctors. They're seeing physician's assistants for evaluation, and that's nothing wrong with seeing a physician's assistant. All of us have capabilities. All of us have good capabilities, and sometimes the physician's assistant may be the right person, for you. But understand that the healthcare system is becoming more and more overloaded. That the healthcare system is becoming, what's happening with insurance premiums and how difficult it is to pay for that. You really have to have a good relationship and a good level of confidence, and when you don't, or when you're being shifted around, or when you feel you're being given short shrift, that you're really not getting where you need to go, yeah, it's time to get a second opinion with somebody else that you can trust. And frankly, you got to find somebody you can trust, and that may come from personal referral. You talking to another friend of yours who has a similar problem, say, I've got this doctor who's great. That may be the best referral you can get these days.
That's a good point. That's a daggone good point. Another thing is that I want to tell you, because this is I'll see if I can get my personal thing, and you got one more story. If we got time, you tell your story. But For years, I've been plagued with gout.
Yeah.
We made a trip to the Holy Land, and I had 4 pills left at the time, and which the doctors won't let me take now, but I was able to take them years ago. And I went to the Holy Land. I got there, and the first day I had gout in both feet, the toes, and that's where the gout usually is in the feet. But I didn't really have enough medication, and I had to make a decision. I could either walk on the gout or else I could sit in the hotel room while everybody else went and decided to the site. So I made a decision to go with the people. And it was agony walking on those feet like that, but I did it. You can do a lot what you want to do if you make up your mind. But for the last several months, I had a horrible pain. I talked to you about it in my right leg and my knee. And it shifted from my left to right. And I said, gee, is it my knee? Do I need a knee replacement? And they checked, and they said, no, it's not that. But nothing was showing up because it was in the knee. And I got to thinking, gosh darn, I've had the gout. I haven't had gout for years. But I just went and I touched my right knee, and it was hot. And so I made an appointment with my primary care doctor because his VA assistant had thought that I might have the gout. And she gave me some medication. It helped a little bit, but it didn't help enough. And some of the medications I can't take to prevent the gout. So I went back over to see my primary care physician, and he checked, and he was checking both the right and the left knees, and he said, yeah, the right knee is hotter. And he asked me some more questions. He said, you know as well as I do, you can get gout in your feet, you can get it in your knees, you can get it in your elbow. It's not common, but it does happen. And he said, we can do this or we can do this, but he said, I can put a shot in there. And he had done this once before for something else that really helped my problem at the time. I said, what do you recommend? He said, for me, Joe, he said, I would use a shot. I would try it to see if this is going to be the fastest way we're going to know if this is really going to help. If I put you on medication, it's going to take days. He gave me the shot. And that was 3 weeks ago. I've had very little problem with that knee since then.
Neat.
But he also put me on a very, very small dosage of prednisone.
Yeah.
Small, not a 6-day pack or anything like we're talking about. And right now he's taking me down 1 milligram at a time to get me off of it the right way to see if I start picking this pain up again. But that's how you can work with your doctor, and by talking and by the doctor. I'm fortunate because I've had the same doctor for 25 years. Few people can say that today. So many people change doctors so much. I just feel fortunate, and you have the added advantage that you are a doctor.
That's true.
So, what was the story you had? You said you had one more share.
Yeah, how much time do we have? Do we have enough time?
Yeah, we have time.
Okay, so here's the deal. I was exercising. I fell. I made a mess of myself. The scabs I covered over by wearing long sleeves for a long time, but the shoulder really didn't recover very well. I saw my chiropractor, who I dearly love, and he was helping me and trying to give me some physical therapy types of work in order to be able to help me get better. I wasn't getting any better. He said, I think we ought to get an MRI. So we made an appointment to got the MRI done. The MRI came back, full thickness tear of your rotator cuff. He looked at it, he said, well, if it's full thickness tear, the only thing that could be done would be surgery. Let me show this report to a couple of orthopedic surgeons that I know. He showed it to the orthopedic surgeons and told me that I would have to have laparoscopic surgery again and be put in a wing splint. On my left hand, I'm left-handed for 3 weeks. I said that was unacceptable. Besides that, it's getting better. Now, I don't know if it was getting better up here, I'm pointing in my head, or if it was getting better, but it was getting better. I did something that you can do too. I'm talking about everybody who's listening here. I called the radiologist and I said, can you describe what you saw there? He said, yeah. I said, yeah. He said a full thickness tear. I said, how come it's getting better? He said, well, I want you to picture it this way. Think of the rotator cuff as a rope. Think of a hole being drilled in the center of the rope. The rope was intact. There was a full thickness, and there was a full hole through the center of the rotator cuff. He said, I would wait a few weeks, and it'll probably get better. Take a look at me now.
You can move your arm.
There you go.
So that's the value of looking into things.
Call your radiologist.
Yeah, thank you, Dr. Sheldon, for being with me today. I always enjoy doing the show because I feel like we talk about honest, easy things that people can understand. I want to thank you, your listeners, for listening to us today. And if you want to watch the show, you can go to helpingseniors.org and watch it. It'll be up on eBay tomorrow night. Not eBay, but on YouTube. See you next week.